Hello, my name's Bethan Riley and I've been doing this treatment for over 25 years at this trademark clinic called Springback Clinic. I think this is the only way I can get to speak to real back pain sufferers out there. So this is directly via the internet. I want to tell you about this treatment using airspring technology. I want to do this before I retire, in case this treatment will be lost forever. It's been designed by British engineer Robert Taylor and was promoted by Eric Mason, CEO of a large international pneumatics company, SMC, which is based in Japan and Milton Keynes. It took 15 years of research and development and tens of thousands of pounds from SMC to produce this specialised tool. The clever design gives feel and control to these 4 piston pads. This gives power and control for a skilled operator to use to remobilise the joints of the spine. For this to make sense to you, I'm going to show you the theory behind this technology. So first I'm going to start with the skateboard. It's a swivel joint. This is equivalent to the disc, the spinous processes and the facet joints, which are synovial joints. I'll show you on the spine itself. The disc, the spinous processes and the facet joints here, one either side, and these are synovial joints with cartilage and synovial fluid and ligaments. The essential point to realise about the skateboard joint is that it has to be centrally pivoted to move in all 3 directions. If it's off centre, it starts to function as a stiff joint. So getting back to the human spine, these joints have to be centrally pivoted all the way through the spine so the forces can flow through in all 3 planes. This worked well when we were on 4 legs because we just rolled along. But coming on to 2 legs, nature had to adapt by making the facet joints come up sideways to block the rotational movement. Bring those joints closer to the camera so that you can see that there's blocks here. There's also blocks in the neck joints, but when it comes to the thoracic joints, the ribcage joints, the joints are now flat. And this is where rotational movement is more free to occur. But you've got to remember that the ribs are attached to these processes here, so often they'll block over rotation. So the upright human spine is very vulnerable to rotational accidents, especially severe ones such as in car accidents with seat belts, bad falls off horses, off motorbikes, and particularly sharp falls on the backside where when one is falling, there's often a rotational force involved. So when you have a shunt or a major fall on the backside, it's usually a bit of an angle as you're landing, bang, it'll swivel up here because that's the first joint to be able to move. And if it's so forceful, it will actually take the muscle with it and beat the muscle reflex. So once these joints are off centre, they'll function as stiff joints and block the flow of forces going through the whole back. This is now equivalent to a chassis accident in a car. What the chassis does is distribute the weight evenly through the whole car frame. So when the front tyres go one way, the back tyres counterbalance and the flow of forces is spread through the whole chassis. If you don't rejig the chassis, you'll have all sorts of problems later with the car, initially starting with the tyres and retracking, which is basically what the manipulators do. For the human back, once there's a block in this area of the back, all the forces will be concentrated on the lower back and round the base of the neck. Huge forces will be compressing on and off on just a few joints of the back. The effect on the human back is profound. Forces will be stabbing, an occasional nerve will be hit and there will be swelling. And these spinal nerves innervate every part of the human body, sometimes causing pain, interrupting bodily functions or giving us headaches. Most of these incidents will be episodic. If the spinal nerve has been irritated, then the spine tries to protect the nerve by taking the weight off it, putting the surrounding muscles into spasm to lock it temporarily as the nerve recovers. This is why placebo medicine is so effective, as it convinces the patient that they are being treated while it allows the body to self-recover, and when it does recover, claim it as a success for their treatment. To demonstrate the protective posture, if a nerve is irritated here, the spine will twist away to increase this gap to take the pressure off the nerve. To reduce this curve in the spine, you drop your weight onto your heels, sink your back into your sacroiliac joints with a twist and drop your core muscles. And when you're in this position, you don't use the rib joints. It's a bit like having too short a shoe and stubbing the toe with every stride you take. It would be much more sensible to correct the shoe length to stop the stubbing before repairing the toe or try to walk differently to take the weight off it. This would cause all sorts of other problems. If the spine is not remobilised, spinal surgery will commonly be a failure. Hence, a third of the funds in the NHS for spinal surgery is used for litigation. As the pounding continues, the joints are under a continual state of inflammation and repair. Ligaments tear and collapse of the disc. Extra bone is laid, cartilage erodes, and for some spines the vertebrae eventually become fused. So then the weight will then go onto the next joint. As the thoracic spine continues to stiffen, there is more stress on the neck joints and breakdown starts to happen here as well. The answer is to unstiffen the joints. So we come to remobilisation. The best way to restore the movement in a skateboard joint is to rock them back and forth through their range of movement. The Maitland technique tries to do this by hand, rocking the joints back and forth with the thumbs. As you see, this is not very clever, as the facet joints are all interlinked. We are talking about joints that have been pre-rotated by a very forceful rotation, probably about 10 years plus years ago. They are well stuck. The spinal joints are much bigger than the joints of the human hand. Any form of twisting on the spine will put all the movement on the unstable mobile joint, not the fixed one. It comes down to the chassis accident of the car. Realigning the tyres with manipulation will only provide temporary relief, and then no help as the tyre breaks down. Observing the protective posture, it's often best to let the spine recover itself rather than tell the patient that the pelvis is crooked and try to forcibly straighten it. So why is air spring technology different? Let's look at the spine. As explained, rocking back and forth does not work. Counter-rotate is the only way. But now the problem is we need something that is strong but safe, but will have to fit all types and distancing of the individual joints. Let's go back to the skateboard. I'm going to use a bag of air pressure to fit the joint and then push through the bag of air. It fits the joint. If I increase the pressure, it just makes it a harder spring. All the push comes from me and I can virtually feel through the air spring. With the mobiliser in action, the therapist allows the air pressure to build up and then pushes through the air pressure. So coming back to the car analogy again, it is like the difference between solid tyres and pneumatic. The skin of the rubber tyre that contains the air pressure. The tyre pressure moulds to the road surface and irons out the rough surface. A solid tyre would not be a good experience. So with this technology, we can introduce a safety mechanism by calibrating a valve to expel the air, if we push too hard or the joint resists movement. So with experience, the therapist allows the air pressure to find the next joint distance. The patient receiving treatment does not feel something hard on the back, but a sort of pressure. We now have something that is mouldable, powerful and safe to remobilise the joints. Once the joints can move again, the same pistons can become rapid patellar hammers to restore the muscle tone. Initially, the back has a dead feel, but when the muscles start to reflex and restore their tone, and the joint is freed, leaving a natural reflex to realign the joint, gradually getting a spring back in the spine. If your spinal joints have been freed, we encourage walking more on the balls of the feet, which enables you to use the core muscles to keep the thoracic spine moving, to stop this pounding effect on just a few joints of the spine.